Professor Lockett. This is Tasha. I'm Ryan Gores for week 6 abdomen assessment on my partner Howard Gores. So initial inspection process, you're looking at the contour, standing on the right side looking down. I'm not seeing any bulges. His stomach is nice and flat, not scaphoid, which means caved in, or protubent, I don't know if I'm saying that right, but which is like the pot belly. So his is nice and flat. I would use, of course, I just have my cell phone, a light to shine over the patient's abdomen to make sure that I'm not seeing any bulges sticking up, anything noticeable. The only thing I do notice on him is the aortic, which is pulsating, which is down a little bit, but I do notice that in the left upper quadrant. His umbilicus is midline and inverted, which is normal. Protrusion, or if it was deviated from the side, would be abnormal, and that could be because of mass inside or surgery. And symmetry, I forgot to touch on that. He is symmetric bilaterally, no curves in his spine, which makes one side possibly larger than the other side. Hair distribution is normal in a diamond shape for a man, whereas a woman it would be an inverted pyramid. His demeanor is relaxed. He's comfortable on the exam floor, and he has a benign racing face. When I'm listening to bowel sounds here, I'm going to listen in all 4 quadrants, starting in the right lower quadrant. So I'm just going to be listening. Sir, you can breathe normally. And I am hearing bowel sounds in all 4 quadrants. I do just want to double check that is recording. Sorry. Alright, so his bowel sounds are active. Absent bowel sounds, you'd have to listen for 5 minutes to be able to accurately document that. I don't notice any vascular sounds like a bruit, even when I was auscultating over the aorta, which is what you'd be looking for. Percussion, I'm looking for tympani. We're going to do percussion in all 4 quadrants in a map that was mapped out by Jarvis in our book. So I will be percussing that here. I hear tympani, which is what you should be hearing. And then percussing the borders of the liver and spleen, I do have a measuring stick. So I'm going to look down the right mid-clavicular line, right about the nipple level, and I'm going to percuss down until I hear it change from to that tympani or resonance to a dull. And I can actually feel it right about there. I do have a pin that I'm going to mark. And then we come down from the abdomen, going up, going from the tympani to that dull tone again, which is right about here. Marking that. And then we measure that, which in centimeters for my gentleman here is right at 6.5 centimeters, and a normal is between 6 and 12. For a man, especially with his good musculature. An enlargement could be due to cirrhosis, or other liver diseases, hepatitis, etc. Percussing for the spleen is on the left midclavicular line. You're looking down, usually between like the 9th and 11th intercostal space there. And again, you're percussing that dullness, or that, hearing that dullness from the spleen all the way down. And I can hear that from about there to there. Palpation of the abdomen includes, he's really ticklish and I forgot that, I'm sorry. So light palpation, I did let him know that we could do the hand on his hand to help palpate, but he said that that would be alright. So starting in the right quadrant, the light palpation, you're going down about 1 to 2 centimeters. You're using soft circular motions. Being familiar with the organs that are in each quadrant. Helps us be able to better identify issues if there's a mass or a lump or a rigidity in one area versus another. It's good to know possibly the origin of that disease or process. Deep palpation is the same type of palpation, except we're going 6 to 8 centimeters deep, so it's just a little bit firmer. You are doing still that soft circular motion. And you can watch and make sure, of course, that you're not hurting your patient, but you can also verify their face. He's not having any grimacing. He's not having any pain or tenderness anywhere that I'm palpating, sir.
No.
And so that would be something that you would want to keep in contact with your patients about that. So, palpating the liver, we go down again through the right clavicular. Actually, more so as we do it like a clam where we have his rib. I'm supporting it over here, and I'm putting my 4 fingers kind of right underneath the rib. He's going to take breaths in and out. And as he does breathe out, I'm going to just advance my hands about 1 centimeter up if I can. And we do that a few times to get up and see if we can feel the border of that liver. Even with a deep breath in, I'm not feeling any bump or palpating any mass that I would feel like would be the liver or a mass. And then the spleen is kind of the same way. I'm going to take my left hand and hold up on this rib. I'm going to use my right hand kind of pointing it to the axillary line, and he's going to do the same thing with big breaths. And when he exhales, I'm just going to increase it up. Increase it up. A normal spleen is not usually palpated, and a palpable spleen could be an indicative of a leukemia or lymphoma diagnosis. And then the kidneys. So make sure I'm doing it right here. The kidneys are down on each side, just a little bit lower. Almost, I said the shell effect earlier, but this one really is more like a shell effect. You go kind of right at their abdomen and push in, and as they take big breaths, sometimes you can feel the pole of that right kidney bumping in between your fingers. I can't feel it on him, but that doesn't mean that someone else who is more comfortable with that palpation would not. And then it would be the same thing over here, but a little bit lower. And big breaths in and out. And I'm not feeling anything on this side either. And that would be the end of the abdominal assessment for Unit 6. Physical assessment for the professional nurse. Thank you, Professor Lockett.